Good morning, everybody. My name is Richard Black. Quadrant D is my company. I'm also a professor of the practice at Tufts University in the Friedman School of Nutrition Science Policy. My presentation is, I'm going to hope to give you a sense of what has worked for the food industry and what hasn't, some of the trade-offs that happen and people are forced to make. I'm going to talk about partnerships as well. You're going to hear after my talk more in depth on that, because it's one of the critical approaches for the food industry, beverage industry specific as well, to deal with these sorts of challenges. My disclosures, I don't work for a food company now. You can see I've worked for a number of them in the past. Currently I'm, as it says, consulting, so you'll have these later to read if you'd like. These are the 4 topics that I want to cover up. I found this little cartoon at the top, and I thought it was appropriate, because it really feels like we're trying to build bridges across something. And you're at this point, okay, who's going to go next to try to fill that last little bit of a hole? So I'll talk a little bit about establishing trust, because that's critical. Statistics, damn statistics. I want to highlight the challenge that we have in interpreting the data. And you heard in the previous talk, I'm going to correct something you said. You said that children are still advertised to. It's fair to say children absolutely see the advertising, no question. And that's a real challenge. But they're not targeted specifically. I'm saying understand, say for Coke or something like that. But they see a ton of Coke ads. And it's the language around this that I want to talk about as well. Building on success, acknowledging some failure, and then, of course, what's holding us back. So I love this thing. Jack Bobo came up with this. If they like you and they trust you, your facts don't matter. If they don't like you and they don't trust you, your facts don't matter. And that's what we face a lot of the time in these sorts of things. And it underpins the challenge that we have in front of us. I work a lot in this space of building trust, and it is a key tactic for the food industry, for people in academia, for people in NGOs. You have to establish that trust in order to get anything done going forward. Sometimes it's very, very difficult to do. It's not an all or nothing thing, it's a spectrum. So one end of this thing is blind trust in an individual or institution. Betrayed, it doesn't matter. It's going to persist nonetheless. You might remember Trump saying, I could go out on Fifth Avenue, shoot somebody, and they'd still vote for me. Do you remember that statement? Yeah, so blind trust requires a certain amount of self-deception. Then there's simple trust, which is devoid of suspicion, but if it's betrayed, it's very, very difficult to recover. The far end, and this is the challenge that we face, I think, typically is what's been called cordial hypocrisy. It's a facade of goodwill and congeniality that hides distrust. Oh, how are you? Good to see you. Yes, of course we're going to get together and talk about this. You turn around and you say something else. It's very destructive, though. It prevents honest communication. But in the middle is what's been referred to, and this is Solomon Flores, as authentic trust. It cannot be taken for granted. It's based on recognition of the possibility of betrayal and disappointment, and so it needs continuous cultivation. That's really what's required, and that's what the food industry and beverages tries to do through the partnerships that they seek to develop. So the 7 features of successful partnerships then are this authentic trust, mutuality. We define a common goal that we're working towards. And I think the lack of advertising of sugar drinks to children under 6, was it 6 that you, yeah, that was a common goal that people could work towards. It didn't mean no advertising at all. Feasibility of achieving the desired outcome, can we actually get to it? Joint planning. It's not the industry saying, well, this is what we're prepared to do, suck it up. It's also not people on the other side, the NGO side, saying, this is what you have to do, otherwise we're not interested in talking with you. It's actually joint planning together. The formulation has to be clear, procedural steps for reducing risk mitigation, general principles for project management, and then complementarity. There are a lot of bright people on all aspects of any issue. And simply because you work in one space or another does not mean you should not be trusted. And I even say, I've seen this even amongst NGOs, one NGO not trusting another, even when they both have very negative views of a third group. And you'd think they would work together naturally, but that is not always the case. So keep that in mind as we go through today as well. I would argue then that we have to recognize and deal with our own biases and recognizing everyone brings something worthwhile to the table. So I'm going to throw this one out and say, pretend that I told you I worked for Whole Foods. I need you to run through this with me. And I've done this lots of different times. Just honestly think about, oh, Whole Foods. Most people go, okay, yeah, I shop at Whole Foods. And they're kind of a gatekeeper for people. I'll listen to what this guy says. Or, I work for Coca-Cola. And really think about that for a minute. This guy works for Coca-Cola. I wonder what he's going to say, right? There's this bias that we have because of the company that you work for. And we need to get beyond that. I laughed at a joke yesterday. I was thinking about this last night. Yeah, I'm with the pest control. I laughed at that when we heard about the pest control from our lawyer. She was talking about people. And we kind of accepted that. And that's a problem. And I didn't think of it at the time. But it's a problem when we can use derogatory terms about people that we're forced to work with that way. I understand why. I thought it was funny too. It's a challenge. So I'm going to repeat this. We must recognize and deal with our own biases, recognizing that everybody brings something to the table. Let me talk quickly about statistics. The food industry doesn't, the beverage industry doesn't target, outside of Capri Sun, I think, and I used to work for Kraft a long time ago, doesn't target children under the age of 12 by and large with their advertising. They see a lot of advertising. Dancing with the Stars is one of the most popular TV programs. If you advertise on Dancing with the Stars, your ad will be seen by more children than if you advertise on Nickelodeon. But if you want to hit the parents, the proportion of kids watching Dancing with the Stars relative to adults is relatively small, the proportion. And that's how it's determined. I think is it 33%, 30% of kids? Anything more than that, that's kids-directed advertising, if the audience is more than 30% of kids. But the absolute number of kids watching Dancing with the Stars is massive compared to Nickelodeon. And that's the challenge, and that's why so many kids see so much advertising. This is data from CDC. And I could say adult obesity is going up from 1999 to 2009. Daily per cap from sugared beverages USA is going down. Problem solved, isn't it? Play with me on this one, please. But if you look at the actual consumption patterns, and we talked a little bit about this yesterday, what's the high end look like? The top 25% of people are consuming the majority, in terms of consumers, they're consuming the majority of the product. And some people are even consuming like over 500 kcals a day after day after day of sugar-sweetened beverages, adults. My point isn't about adults. My point is, how do you look at the data? And in this case, I could say, you know, overall, there's not, the whole thing is going down. And even the people at the high end are going down, but they're still really, really over-consuming. My point is, how do you look at the data? This last one shows you the top dots are Mexico per cap, or Latin America data, I think it's Mexico, per cap consumption rising up. The bottom lines are India. And you'd say, whoa, just not a problem in India. Not a problem at all. Look at I mean, that's virtually zero on per cap consumption, except for the fact that virtually all that consumption is occurring in urban settings. The data are for the country. And in India, most people don't live in the big cities, they live in the countryside or rural settings, small villages. Most of the consumption comes in urban settings. If you look at the actual people who are consuming the product, that's where we need, I think, to focus our understanding on the impacts and so on and so forth. My point here is that you can look at any set of data and pull all kinds of different information from it, and everybody can come up with their own interpretation, and we have to be careful of interpreting things in a way that we would like to see them interpreted. We heard yesterday about DGAs, from the DGA guidelines and the WHO and the 5% added sugar. And the comment that was made was, WHO has the science to support the 5% sugar recommendation, added sugar recommendation in the diet. No, if you look at what it says, it's a conditional recommendation in that, I looked it up at the time, Conditional recommendation, meaning we need more science. It was based on 3 studies for dental caries in Japan in the 1960s, and fluoridated water was not available. And that's where and the 5% is based on dental caries only. So if the food industry made that kind of a claim with that robust level of data, they'd actually be skewered. I just point that out to say we have to be very careful. The food industry should not look at that first chart in the upper left and say, oh, we're done. Absolutely not. You have to look at who's consuming the product. What's my point? You got to give me good data and interpret it well, or we're going to have really bad policy decisions. So, some specific examples. 10 years ago, working with the Clinton Foundation, the beverage industry voluntarily removed full-calorie soft drinks and other beverages from U.S. schools, led to about a 90% reduction of beverage calories shipped to schools. The Clinton Foundation at the time got a lot of criticism for partnering with the food industry, the beverage industry on this, but it had a real impact on what was going on at the schools. Under the voluntary guidelines, 100% juice, low-fat milk, water are allowed in elementary and middle schools, while in high schools, students have also have access to diet beverages, calorie-capped sports drinks, flavored waters, and teas. Beverage companies have all publicly committed to not advertise, not market, and that's a big bone of contention for me too. I agree that this fuzz between what's advertising and what's marketing is a real challenge to get through, and I think the commitments need to consider marketing, not just advertising. Advertising is the first step. But the debate continues then on what is actually advertising. Healthy Weight Commitment Foundation, people may be aware of this one, exceeded its targeted goals of calorie reduction by a factor of 3 to 4. I'll show you some of the data on that as well. The initial target was to remove 1.5 trillion kcals from the diet on an annual basis by 2015. But member companies actually succeeded in removing over 6 trillion kcals on an annual basis. It was massive. It was a really, really big success. Had a long conversation with Dariusz Mozaffarian about this. He was convinced they knew what they were doing going ahead. But those of us, there were some people in the room that were participatory in that. We had no idea if we're going to be able to make those numbers at the 1.5 trillion level. Many challenged the interpretation of the outcome. So this is data from Barry Popkins. There are 3 lines on this. So if you look at the left-hand side of the panel, the solid blue line is actual data. That's what the trend line was on calories for all the products, not just beverages, all products in the companies that participated. The dashed light blue line is the linear trend decline, and the dark dashed blue line is the counterfactual model that Barry developed, meaning this is what we would have kind of expected to happen if nothing else had been done. If they didn't do anything else, the counterfactual, that's the phrase that's used, that gives you the dark dashed line. And then the red is what actually happened. And Barry would argue, meh, we should have seen that decline anyways. My point is that when I look at that dark blue dashed line, that's a negatively accelerating curve, which would get us to 0 in about another 10 years. Not very likely. And so I question the validity of some of the models that go into this. In other words, I would have argued that the linear trend is the more appropriate comparator. But many people would say no. It's actually the counterfactual model that Barry developed. I'm not arguing right or wrong here. I'm just saying, let's please acknowledge that when we talk about these things, we have to give credit to the other person's point of view and listen to them work through the arguments. Some of these efforts do have a lot of impact. For several years, and I'm going to say after some coaxing, thank you CSPI, and really, thank you CSPI for that one, calorie information has been placed in the front of every product to give consumers clear information. Here's Kickstart. I chose this image because you can see the calories 80 at the bottom. This is a 16-ounce can, not a 12-ounce can. Typical 12 ounce is 150, 160 kcals. The interesting thing for me here is that new products are developed with lower calorie content from the outset. There's no consumer expectation to be matched, but rather this product sets the expectation for the consumer. It's a different approach. You're not trying to take a base product and lower the calories that are contained within it. Some products are quietly being reformulated to contain fewer calories, but the challenge is the consumer acceptance of that product. And so I'm going to say, consider what is generally referred to as the don't mess with my Coke phenomena. I'm sure some people are familiar with New Coke. Do you remember that? Yeah. Not everything works as expected. So let me take you through that. And this gives you an indication of the challenge of altering a beloved product. As people say, why don't you just take the base product and get the calories out of it? So New Coke beat Pepsi by 6 to 8% in taste tests and was preferred over Classic Coke. Preferred over Classic Coke, 55 to 45 in blind taste tests. For Coke consumers, they preferred New Coke 53 to 47 in blind taste, and in unblinded, they preferred it 69 to 31. Reports state Coca-Cola company spent, and the data comes from this marketing research article, R. Schindler, 1992, over $4 million in 8045 to test the acceptance of the new formulation, interviewing the taste test over 200,000 people. Initial sales results were positive, even better than expected, but then the news stories started to appear about those who preferred the original recipe and of protests organized against New Coke. Yes, there were protests. By June, 2 months after launch, only 30% of people said they preferred New Coke. People wouldn't accept changing the Coke. It was like saying you're going to make the flag prettier. That was a comment. People were willing to take New Coke if they could still continue to buy the Coke they always loved. And that's really what it came down to. If you're going to take that other Coke away, I'm not interested. There have been attempts to reformulate sugar-sweetened beverages to have a lower calorie content, but the challenge continues to be that similar to New Coke. Interestingly, reformulating a favorite to 100 kcals may be an issue. So 150 to 100, remember it's on the front there. It seems as though when you get the 100, that flags to people you've done something odd to my product. But a number 0, 150, 140, 160, 130, not so much. They don't worry about it so much. I don't know why that's the case. But little things like that play into the change and the dynamics and what happens and how accepting it is. So this may limit what customer was willing to accept. To drop to 120 kcals seemed not as striking. But that's not a product that was launched. This is just consumer testing. Another key consideration is the notion of consumer segments, how they differ, their receptivity to health messages, and so on, and the trust in the messenger. NDA has this spectrum of consumers from the super healthy on one end to the eat, drink, and be merry on the other. And this eat, drink, and be merry, you'd think, oh, so college guys. No, there are all kinds of folks in here. They're just not interested in the health message at all. So any change has to be under the radar, has to be hidden, stealth nutrition for that folk. On this end, it's probably worthless because they do their own research, they'll figure it out on their own, and there's a large clump in the middle right from about 65% of the people. That's, I think, where we can target our message. But we have to understand how to get to those folks as well. In other words, there's simply no one-size-fits-all solution. That's really the point I want to make with that. Taxing sugar-sweetened beverages received a lot of attention, especially in Mexico, but this is the point I was trying to make yesterday. $1 Mexican peso per liter, the tax was positioned as a simple flat tax. It was felt implementing gradually was too difficult. However, the Mexican tax as implemented is, I'm going to make this point, is a graduated tax, but based on grams of liquid, 1 gram is 1 mil, rather than grams of sugar. It's 0.01 peso per 10 grams liquid. Why wouldn't you just make it per 10 grams sugar? And then you incentivize differently. Placing a tax on the grams of the beverage, which is of course equivalent to mils, removes any incentive on the part of the beverage producer to reduce sugar content in the beverage. No matter the sugar content in the drink, the tax is the same. We also heard about tiered as well yesterday. A graduated tax, in my view, based on grams of sugar in the beverages, not the grams of liquid, incentivizes both the consumer and the beverage industry. And you can model this out to say, what are we getting in today? Right, it's $1 million a year. Fine, if I change it to this, I need to do it in such a way that I continue to get $1 million a year in my revenue stream. You can work those things through. Although the overall sugar-sweetened beverage intake significantly declined in Mexico, consumption of colas, specifically colas, and this is out of Barry's paper, declined by only about 1.5 kcals per day. Sugar-sweetened non-carbonated beverage declined. Overall sugar-sweetened beverage declined, certainly. But if you look at the data on colas from his paper, now this is 6 months in, it was 1.5 kcals per day. I would argue, at Berkeley, different story though, but I would argue that Coca-Cola, the brand, is so ingrained in the social network, of Mexico, it's going to be very, very difficult to do otherwise. It's going to be a really hard sell. What's holding us back? I think failure to leverage the digital world. I'll go through this really quickly because it's interesting, but we need to leverage that. Roughly 3.3 billion people have access to the internet, 1 million more each day. 6% of the global population has access to personal mobile devices, sending and receiving. 3.3 million emails every second, 85% of which are spam and virus. Social media is over 20% of the time spent online. 2.8 billion YouTube views a minute, 10 hours of new video uploaded every second. 4,000 tweets a second. Facebook, we're a country at 1.53 billion active users, is bigger than China and India. 13 years ago, Skype, Facebook, YouTube, Twitter, Tumblr, Dropbox didn't exist. 23 years ago, there were only 130 websites. Today, 250 websites added every minute. And 26 years ago, there was no internet. My point here is that there wasn't one talk in this whole workshop on how do we leverage this to change behavior. Missing this, we miss the opportunity. What happens? Misinformation. Misinformation. And we all know this. And this is a funny one. Survey from Oklahoma State University Department of Agriculture found that 80.44% of people supported a government policy mandating labels on foods containing DNA. Not GMOs, DNA. Yeah. So the warning label, this product contains deoxyribonucleic acid, DNA. The World Health Organization has determined that DNA is linked to a variety of diseases in both animals and humans. Some configurations, it is a risk factor for cancer and heart disease. Pregnant women are at very high risk of passing on DNA to their children, and DNA can be transmitted in body fluids. What's my point? Capitalizing on public misunderstanding serves no one's interest in the long run. It can be terribly detrimental, and we all do it. We all do it. There are those who are willing to do so, and they will succeed if there's not a countervailing voice. We need to be very upfront about this. So be aware of and seek, last slide, to solve the problems that each partner faces in these things. There are partnerships. Hold everyone accountable. Hold yourself accountable. Hold the other person accountable. That's critical. Industry needs to be held accountable. Establishing well-grounded targets that can be measured and interpreted, and for meeting those targets. And then all of us need to be active supporters of the efforts. You can't back away and say, oh, I don't want to get involved in that fight because I'll get tarred and papered. You have to meet the criticism with the facts, improving the approach where possible, and not passively watching as others seek to tear down what has been built, or, more importantly, I would say, what must be built. Thank you very much.